Patients normally wait no longer than a week to see me in clinic, and if it's an emergency, I can see them that day if necessary. When a patient comes to see me with abdominal pain, I will take a full history. So I'll ask them where the pain is. With gallstone pain, it's typically in the upper abdomen. Sometimes it's very poorly perceived, and some people say it's just a generalized ache. Sometimes the pain goes through to the back, and sometimes it goes to the right shoulder. After I've taken a history, I will ask them to lie on the couch and I'll examine their abdomen. The reason for that is that some patients who have inflammation of the gallbladder will have quite sharp tenderness just underneath their rib cage. And sometimes you can in fact feel the gallbladder itself. Why do people get gallstones? Well, the gallbladder is actually just a storage bag. It doesn't produce anything, it just stores bile. So when you eat, it contracts and squirts a bit of bile down into the bowel, which aids digestion of the food. What happens in the gallbladder is that substances that should stay within a liquid form precipitate out in the bile in the gallbladder. Typically, the investigations that I perform are routine blood tests, which include blood tests related to the liver, and an ultrasound scan. It's a fairly simple test, and it's non-invasive, which means the patient doesn't experience any pain, doesn't have to have any injections. If there's any worries related to the duct connecting the liver to the bowel, or the blood tests are abnormal, they will undergo an MRI scan just to make sure that they haven't got stones elsewhere than in the gallbladder. Once we've both agreed that the patient requires surgery to remove their gallbladder, then it's up to the patient to contact my secretary and arrange an appointment when they're available to have the surgery. Typically, a patient would wait no longer than 1 or 2 weeks. A common question that patients ask is, why don't you just remove the stones? Why do you have to remove the gallbladder? My answer is that it's impossible to remove the gallstones without opening the gallbladder. So what will happen is the gallstones will just fall out into the abdomen. So it actually will be harmful to the patient. Another couple of reasons is that the patient doesn't require the gallbladder. So if the gallbladder is removed, the patient is no worse off than prior to surgery. And the other main reasons is that if we did leave the gallbladder in place, all that would happen would be is that they would just reform stones within the gallbladder.